Hey guys, Dr. Eddy Dona, specialist plastic surgeon. I want to talk about a big topic in breast implant surgery, and that is the internal bra. It's a term which is used a lot amongst plastic surgeons, and I have to say it's often misused. So what does that mean? Well, when you're doing a breast implant, certainly when I'm doing it, when I created a video about this topic about 10 years ago, when you're closing up the patient's wound, what I would do, I think what most surgeons I believe should do and do, is 3 layers of stitches. You have your internal deepest layer of stitches, which is designed to hold things in position. And when I described this about 10 years ago, I said that that was like an internal bra, but it's not a real internal bra. Then you have your other 2 layers as well, more superficial layers. So basically, the deepest layer of stitches that you use to essentially secure your implant in position, every breast augmentation should have that. And that has been described as an internal bra, when really it's not it. That's not what an internal bra is meant to define. Also, when patients have got implants and things have moved around a little bit, so their breast implant pocket have stretched out over time, you may have to go back as a surgeon and make adjustment to the implant pocket and do various stitching techniques to secure and tighten up that pocket. Once again, like an internal bra. But those stitches are not what a real internal bra is meant to define. A true internal bra should be used to describe what is an internal mesh that is applied. And I've got an example here. Here is a mesh designed specifically for breast implants. There's various meshes on the market, and basically what these are designed to do, like an internal bra, you've got the external bra, well, this is an internal bra. It's designed to hold and secure an implant in position to minimize the weight and movement, the weight of that breast implant on the breast tissue and the potential movement that that implant may have. So when do I use a true internal bra? Only in complex revision cases. Otherwise, it's not something I'd routinely would use or need to use, for a variety of reasons. One is they're very expensive. They're far more expensive than the implant themselves, but they also come with their own potential problems and issues. So you only use those when you absolutely have to. So that is what a true internal bra is. It's basically a bit of synthetic mesh, the various types, as I said, on the market, rather than that term being used to describe various stitching techniques, which every surgeon should be doing anyway. Anyways, if you want to know more about breast implant surgery, give our office a call.